Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is Colles fracture. So this is the diagram of Colles fracture. You can see near the styloid process of radius this injury happens. Let us introduce. First time described by Abraham Colles in 1814. This is a injury or type of injury which happens on fall on outstretched hand. Description: Colles fracture is the fracture at the distal end of the radius at its corticocancellous joint about 2 cm from the distal articular surface. It is not just the fracture of distal radius but the fracture dislocation of the inferior radii-ulnar joint. And this type of injury generally found above the 40 years age group, occurring most commonly in women. Pathoanatomy. As this is the displacement, the fracture line runs transversely at the corticocancellous joint. In many cases, one or more displacements may occur as follows: impaction of fragments, dorsal displacement, dorsal tilt, lateral displacement, lateral tilt, supination. Now clinical features: pain, swelling, some deformity also happens. There is a classic dinner fork deformity seen in Colles fracture. You can see in the diagram also. Radial styloid process lies in the same level or little higher than the ulnar styloid process. Now diagnosis. How you can diagnose this type of injury? It is important to differentiate between Colles fracture than other fractures occurring at the same site, such as Smith's fracture, Barton's fracture, looking at the displacements. X-ray. Lateral view. Dorsal tilt, it can be detected by looking at the direction of distal articular surface. And anterior posterior view. Lateral tilt. Similarly, it can be detected by looking at the articular surface. If it faces medially, it is normal. If it becomes horizontal or faces laterally, a lateral tilt is present. Now treatment. There are some method of treatment. First, conservative method. For undisplaced fracture, immobilization in a below elbow plaster C for 6 weeks. So what happens in undisplaced fracture? Immobilization in a below elbow plaster C for 6 weeks. And for displaced fracture, manipulative reduction followed by immobilization in a Colles cast. Surgical method: closed reduction and percutaneous pinning with K wires, and open reduction and plate fixation. And another method of treatment is manipulative reduction method. In this method, there are 3 steps. The muscle of the forearm are to be relaxed either by general regio anesthesia. Step 1. The first step is to impact the fragments. This can be achieved by firm longitudinal traction against the counter traction by an assistant. Step 2. Press the distal fragment into palmar flexion and ulnar deviatic by using thumb of other hand. Step 3. Now hand is drawn into pronation, palmar flexion and ulnar deviation. A plaster cast is applied extending from below the elbow to the metacarpal heads, maintaining the wrist in palmar flexion and ulnar deviation. After 6 weeks, plaster cast is removed and joint mobilizing and strengthening exercises are started. You can see in the diagram also. Now, some complication may happen. First, stiffness of joint, malunion, subluxation of the inferior radii-ulnar joint, carpal tunnel syndrome, salix osteodystrophy, rupture of the extensor pollicis longus tendon. So this is for now. Thank you everyone for watching the whole video. Do like, share and subscribe for supporting me, and thank you for watching.